The video series Diabetes Educator was developed by the Georgia and Oklahoma Academies of Family Physicians as part of the Go Diabetes Initiative. The Diabetes Educator series consists of 6 video vignettes, each outlining best practices in the care of diabetic patients. Please proceed to the registration page for more information on the approved number of prescribed credits for this activity, as assigned by the American Academy of Family Physicians, and AMA-PRA Category 1 credit as assigned by the Georgia Academy of Family Physicians. Upon completion of each video vignette, please return to the Resources video page on the Go Diabetes website to complete the activity evaluation and earn your CME. This activity is supported in part by an educational grant from Sanofi Aventis. We thank you for participating in this online activity and hope that it serves as a valuable educational tool.
So diabetes education. What is diabetes education? It's a collaborative process that allows for the development of knowledge and skill that is required to change behavior. It will also allow for the successful self-management of the disease and its related conditions. So we've been hearing all morning all great ways that you're learning of how to take better care of your patients with diabetes. What I'm here to talk to you about is the probably most important piece once that patient leaves your office, and is how your patient, what to do with your patient so that that patient really follows that great treatment. What happens if your patient goes home and puts all the great papers away and the prescriptions you gave them at the kitchen table and nothing happens? Nothing happens. So it's up to you and your patient to develop a relationship so that things happen. And part of that deal is diabetes education. And of course, I'm here to talk to you about a new person in your team that can help you and allow you to do this. We heard Dustin talking about, you need to do this and you need to teach him diet and how to eat and how to lose weight and how to do exercise. How many minutes do you have with each patient? 15? You know what is the average amount of time a person with diabetes requires, minimum, to learn? 3 hours. So how long will it take you to give your patient 3 extra hours to teach them all this? We get covered for 10 hours the first year the patient deals with the diabetes educator or diabetes education. So I'm telling you that the minimum is 3 hours. So please, if I want you to leave with something out of this talk today, is you gotta get some help, and we're here to help you figure out who that person is and how we get them trained and how they can help you provide your patients with the information and the knowledge and the follow-up they need to take care of that of their diabetes. So what are the goals of education? To improve health, better quality of life, reduce the need for costly health care. We've heard all about the amputations and the costly blindness and all these other things. Prevention, learning how to take care of your diabetes will allow you to reduce all of that. Now, who are diabetes educators? And I'm going to talk to you more about it, because diabetes educators are health professionals that have dedicated their time to learn about diabetes and teach patients how to take care of diabetes. Not only diabetes educators can provide diabetes education or diabetes information, which is a difference. What do you think diabetes information is? Oh, by the way, you have diabetes, you have to lose 30 pounds, come back in 3 months and read that. How's that gonna go? You know where that's gonna end? Probably in the trash can before you leave the office. Or if they're polite, they'll take it home. They may scan through it, but knowledge does not equate behavior change. How many of you are doing your dental floss like your dental hygienists have taught you? 1 hand raised, 2, 3, 4. So you're all physicians and very well-educated health professionals. You know it needs to be done. Are you doing it? No. So this is exactly just a very simple example. It requires willingness to change, the knowledge, and absolutely doing it. So I'm going to show you the American Association of Diabetes Educators commissioned this research to find out what was happening with patients that were educated by diabetes educators. And this is what we found. The study hypothesis was that patients who participated in diabetes education were more likely to adhere to the recommended care than similar patients that did not go through diabetes education. And that billing claims of those patients who participated in education were lower. So the cost of their healthcare was lower than the patients that did not participate. And this is what we found. 3 groups of physician practice use of diabetes education. So the higher bar is least use of diabetes education. 0 to 5% of those patients were going to diabetes education. These were 6 to 10%, and these were high users. Inpatient costs, outpatient costs, professional costs, and pharmacy costs. So this is the highest cost. And look at it's comprised of what? Inpatient. Although you have higher costs for pharmacy and professional costs in these two, you have an overall lower cost. So the use of diabetes educators allow you, you're going to use more pharmacy because your patients are taking their meds, they're testing, you're going to have more strip use, they're seeing their doctor, so there's going to be more billing for your services, but there's going to be less inpatient use, which is where the high cost is. So this is just to show you how this works. Oh my God, let me see how I'm going to do with this one. As a matter of routine, does your patients with diabetes spend extra time with a mid-level provider assigned to work with them? So we need to take your blue gizmos, and we're going. Tell me if they do, if you are using a mid-level provider in your practices or not. So you're going to do 1 for yes or 2 for no. Okay. Well, very good. So we could say 60% is not using them, 41% is using them. Let me ask one more thing. The group that is using them, are you using the mid-level provider? I'm assuming a nurse practitioner, a PA. Instead of them seeing you, they see the mid-level provider, or they see both in the same visit? Who said yes? Who has mid-level providers? How do you use them? So sometimes they see the nurse practitioner or the PA, and sometimes they see you. And what is the protocol? First visit, they see whom? Okay, so they see the physician the first time, and then they come back for follow-up visits, mid-level providers. That's pretty much what everybody does? Yes? Mm-hmm.
Sometimes we see them together as a teaching opportunity if we're just doing like shadowing. So sometimes it just sort of like curbside happens and it works out and there's the time to do a little bit of it. And sometimes do that, but they always get referred and followed up by the educator.
Okay, tell me a little bit. What is you play which role?
Me, I'm the diabetes educator.
You are the diabetes educator. So the patient is scheduled to see you, and then you come in and you'll see the resident with you?
Sometimes a resident is on a rotation where they're working with me.
Okay.
So we might be together for 3-4 hours.
Got it.
And then we'll see some patients.
Okay, so they'll see how you do it.
Yeah.
Okay.
And sometimes I'm like shadowing them. And so it just happenstance, the patient comes up, there's certain issues or questions, and we might just spend whatever time they had allowed to see that patient, so maybe it's 5-10 minutes, and we might do a little bit of
You spend a little time. Do you do the teaching or they do the teaching? Together?
a mix.
Okay.
Or I observe them, or I do some and observe me.
Okay, okay. Anybody else does it like that? Okay, that's very collaborative.
What we have is on Fridays, for a 3-hour period, we see our diabetic patients.
Okay.
And then we have pharmacists, nutritionists, and physician in one specific area.
Okay.
They actually go through everybody.
They see everybody. So you have like diabetes days and you have the team and they see everybody. That's very good. Excellent. Okay, did you all hear that? Good job, thank you. So let me just show you some of the percentages of how things happen. These are patients that went through diabetes education, these ones did not. And then we divided them between commercial and Medicare. And look at the difference. You know, one A1C test really, you know, doesn't count much, but when we look at 2 tests plus, patients, Medicare patients that went through education had a 61% 2 plus A1C tests a year compared to the ones that did not go through diabetes education. And the microalbuminuria on patients, Medicare patients that went through diabetes education was 60.2% compared to Medicare patients that did not go through diabetes education, 43.8%. So you can see that probably the entire engagement is different. As they're coming through diabetes education, they're coming more to see the doctor. The whole team is making sure that the tests are getting done and that we're checking and complying with the ADA standards of care that we've heard about.